It is now the day after a procedure, and I want to review with you some instructions and suture line care. It is really important that you keep the suture lines moisturized with ointment. You are going to start off with a bacitracin that we've included in your package. Once you run out of the bacitracin, we want you to switch to Aquaphor or Vaseline. You are going to apply the ointment to your suture lines about 3 or 4 times daily. We want to make sure that there's always at least a thin layer of ointment to make sure that the sutures don't get dry. You're going to take a little bit of ointment and apply that right in front of your ear, behind the structure called the tragus, within the crease of your earlobe, and then you're going to drag some ointment within the crease behind your ear. You're also going to take some ointment and apply it underneath your chin. Again, we want you doing that about 3 or 4 times daily. If you do develop any crust, you can use a little bit of hydrogen peroxide, letting it sit on the crust for about 30 seconds, and then it should wipe away. If you keep the areas moist with ointment, that's usually not necessary. As for the supportive garment, we want you wearing that as much as possible around the clock for the first 7 days, and then at night for an additional 3 nights. It is okay to occasionally take a break from the supportive garment. You can throw it in the wash. It is machine washable. It's okay to get the suture lines wet beginning the day after your procedure. Use water for the suture lines, and for your hair, you can use the gentle baby shampoo that we have included in your package. As for activity, we want you taking it easy this week. You are going to do things around the house, but not really much for exercise. 1 week after your procedure, you can start walking around the neighborhood. 1 week after that, we're okay with a quick walk or a gentle hike. You can do a little bit more the week after that, but we want to avoid any strenuous activity for 4 weeks. That would include any activity that is making you short of breath, giving you an increased heart rate or blood pressure. Now, you are going to have more swelling over the next 2 to 3 days. There is going to be a point around day 3 where you look at yourself in the mirror and you will say, "Holy smokes, what did I do?" That is a normal feeling. Just know for most patients, they will start to turn the corner around day 4. It is not until the end of the week where people will look in the mirror and say, "I still look bruised, I still look swollen, but at least I see the direction that I'm going in, and I know it's going to be okay." For most people, it takes about 2 weeks to get to the point where you can go out and about to places like the grocery store, knowing that you might run into someone that you know. The swelling will continue to improve gradually, especially over the first 6 weeks. It takes for most people about 6 weeks to become very happy with their results, but 6 months for their final results. You have areas of numbness in front of your ear, behind your ear, and the front of your neck. That is normal and will come back over time, either completely or pretty darn close. You may get some tingling sensations or even occasional sharp sensations as the numbness is resolving. Usually around 6 months is the point where patients will notice a little bit of numbness here and there, with continued improvement for even the course of a full year. We are here for you. If you have any questions or concerns, please do not hesitate to call us. We will be with you every step of the way, and we are confident that you will love your terrific results.